Hi, my name is Eileen Crehan, and I'm a licensed clinical psychologist and assistant professor from Tufts University up outside of Boston. I'm a white woman with mid-length reddish hair, and I'm presented to you from my home office. Today, I'm going to share my slides on primary care and family medicine providers in autism in adulthood, survey results to inform training resources for the AIRP Research Day at Autism Cares 2023. Also, you'll see on this slide, I want to mention Tate Smith, our Autism and Adulthood Healthcare Working Group, and Simone Dufresne, who've been integral in having this project come together. So the introduction or why we're doing this work, having a knowledgeable medical home or someone who knows a lot about your care and can maybe talk about other aspects of your medical care or home life is associated with better health outcomes for autistic adults and children and people, regardless of neurotype. Um, a big focus in our group is developing provider facing trainings. And so we want to assess learning needs of providers. We know that there are many barriers to healthcare for autistic adults. And so, in an effort to try to address those by better preparing medical professionals, we wanted to do something of a needs assessment. So for our methods, the study overall, like the goal of it and the purpose of it was co-created with our working group that I mentioned, and then our neurodiverse research team. This has been happening over the past couple of years, and we surveyed 66 participants from primary care and family medicine practices in Massachusetts. And the surveys included a number of items, but we asked about sensory environment, knowledge, and resources of providers in particular. And what we found is that providers had a range of experiences with autism. So on this chart, 2 people of the 66 said they never had any experience, 20 said rarely, 23 said occasionally, 17 said routinely, and 4 said daily. And 2 of the participants identified as autistic themselves. In the sensory experience of spaces, we asked people about their practices where people are actually receiving their healthcare services. And we found that there are a number of sort of sensory triggers in these spaces. So one is that 80.3% of the practices had fluorescent lighting, about a fifth, 21.2%, had adjustable lighting, and 25.8% had natural lighting options. And then we asked also about things they might be able to smell in their space. So some options that came back were cleaning and disinfectant, perfume and soap, air fresheners, and alcohol. So that'd be like a smell and hand sanitizers or like alcohol wipes or something like that. The smell of nearby bathrooms, food smells, such as like restaurants being nearby or a cafeteria, and then something that was clumped to surrounding area. And so this included like if you could smell like a trash can or the subway or exhaust from a different building. So lots of sense going on. And finally, we asked providers what topics they do and do not discuss with their autistic patients. And about a third responded never to asking about social engagement. We also asked about a number of other factors, but this was the one that actually was talked about most commonly. And so this is sort of the most positive set of results we see from these providers. So this has established a bit that providers want more information on topics because we also asked, for topics they don't talk about as much, what would help. And we also know from our working group that many medical spaces, such as OB/GYN, mental health, need sort of similar assessments and resources. And we are currently, with the support of an AARP Scholars Grant, currently recruiting provider sites and autistic patients to give us feedback on how the provider sites are doing after they receive this training. And I've included here a QR code that leads to the website that's listed below and my email in case people want to get in contact or might be interested in participating. It's a lot of fun. We've got a great group, so please feel free to reach out or learn some more information. Um, and at the end here, I have my references. Thank you.